I was particularly interested, I'm a radiation oncologist, and so I was particularly interested in the results of the Alliance Pancreatic Cancer study. I think many knew that this was a randomized phase 2 study, and that the arm that included radiation for this study was closed early due to not meeting its interim endpoint. And I can just describe briefly the study. The study was basically patients with borderline resectable pancreatic cancer who were randomized either to 8 cycles of FOLFIRINOX or 7 cycles plus a radiation treatment course that was either SBRT, higher dose radiation, or what they termed hypofractionated radiation, which was slightly lower dose. And then they went on to surgical resection. It was actually quite surprising to many people that the results of the interim analysis closed the radiation arm early, and we were all hoping, I think, that there was going to be some explanation as to what was causing that arm to not meet the interim endpoint. And I really feel a little disappointed that in the data that were presented, there wasn't a clear explanation of why that arm was ineffective. And I think the presenter, Dr. Katz, really said as much either in that session or in the follow-up session. That was really all about neoadjuvant treatment for pancreatic cancer. And I think, to me, now I'm still looking forward to the manuscript where we have some more details. And some of those details that I think will be very important include the reason why there were fewer patients with margin negative resections on that radiation arm. I think, that could be in pancreatic cancer for a variety of reasons, either local reasons with a margin positive surgery or metastatic reasons where you have distant disease that precludes any surgery at that point. There also was not a breakdown of the patients who had the high dose versus low dose radiation. And I think we did not get great data on compliance with the chemotherapy from that presentation. So I think there are a number of things that continue to make us wonder about the results. And unfortunately, to me, I think this is still an open question. It has not been definitively answered from a study that we were really hoping was going to give us a more definitive answer.